All right, class, today we're going to be covering patient assessment management trauma. Go ahead and flip to your page where it says patient assessment management trauma. We'll be covering step by step. The first thing I want you to look at on the very first page is where it says load and go criteria. You will need to know those load and go criteria for your skills exam. ALOC, altered level of consciousness, uncontrolled hemorrhage, compromised ABCs, abnormal chest, tender abdomen, unstable pelvis, bilateral femur fractures. You will need to know all 7 of them, and we'll go through that step by step. You can score up to 2 points per section, so that's a total of 42 points possible. Now, you do have to score 80% or higher. If you flip to the last page of trauma, where it says critical criteria points, if you look all the way down, did not score at least 80% or 33 points. So you will have to score 33 points or higher in order to pass this skill. Now let's take a look at procedure number 1, BSI Penman, body substance isolation. That's when you use personal protective equipment to isolate the person's bodily substance from yourself. Penman, personal, partner, public, patient safety, environmental hazards, number of patients, mechanism of injury, nature of illness, additional resources required, need for extrication, extraction, or need for cervical spinal stabilization. Now, what you're looking for general impression is how does the person look, right? You're getting the person's age, weight, gender, the position the person is found in, any uncontrolled hemorrhaging or any life threats. At this point, depending on the nature of illness or mechanism of injury, you may need to delegate your partner to hold manual stabilization of the C-spine. That is a fail point if it's indicated and you don't say that. So make sure if it indicates you are delegating your partner to hold manual stabilization. Next, you have to check AVPU, which is alert, verbal, painful, unresponsive. That is your mental status. So as you're walking up, the person should be tracking you. If not, you talk to the patient, sir, are you okay? If they respond to you, they are responsive to verbal, painful stimuli. If they're not responding to you verbally or not alert, you walk up to the patient and you apply a painful stimuli. If the patient becomes alert at that point, the patient is alert to painful stimuli. If the patient does not respond to painful stimuli, the person is considered unresponsive. This is your first decision tree you have. If the patient is alert to verbal or painful stimuli, you check ABC, airway, breathing, circulation. If the patient is unresponsive, you go CAB, circulation, airway, breathing. Airway. I'm checking to see if it's open, clear, is it maintainable, need for suctioning, or any airway adjuncts to maintain that open airway. What I'm looking for, is it open? Is he talking to me? Is he breathing? Is it fine? Is it maintainable means if it's not open, I have to open it for him. If I have to do a jaw thrust or head tilt chin lift, if I let go, is it closing? If it closes, it's not maintainable. I need to introduce an airway adjunct, an OPA or NPA. If there's need for suctioning, of course I need to suction. That's going to be covered under the airway skill set under suctioning. Let's look at number 5, breathing, rate, depth, ease, or effort. What I'm looking for, rate, depth, ease. Rate, is it fast or slow? At this point, I'm not counting, that's going to be the vitals. This is either fast or slow or normal, right? If the patient is panting and breathing 30 breaths per minute, that's fast. The depth, is it shallow? Is it deep? Is it normal? The ease and the effort, is it labored or is it unlabored? So if he's having a difficult time getting some breaths in, we may need to intervene with some artificial ventilation using a bag mask device. Assess the lung sounds. So this could mean 2 things. Assess lung sounds. You can auscultate at this point, or you're just talking to him and you're assessing his lung sounds by listening to him. You can hear the lung sounds. If he's wheezing, if there's stridor, you can assess it without a stethoscope. You can listen or you can use a stethoscope. Next, we want to check their SpO2. We're going to put an SpO2 device on this person and make sure their O2 sat is within specs. Initiate oxygen therapy based on patient condition. Is the patient cyanotic? Of course, we need to introduce oxygen. Appropriate oxygen therapy means you have to decide if you're going to put the patient on nasal cannula, non-rebreather mask, or bag mask device. So it's not on here, but I want you to think about is artificial ventilation required? Artificial ventilation meaning a bag mask device. If the patient has labored breathing or hyperventilating, breathing 60 breaths per minute, you have to slow that down, and you can do that with a bag mask device by coaching them. If the person is having labored breathing, introduce that bag mask device. Now we're going to take a look at number 6, circulation, peripheral, and carotid. So what we're going to do is check carotid and peripheral pulse for rate, rhythm, and quality. Rate, again, this is not vitals. You're not counting. That's vitals. That's later on. This is if it's fast or slow. Rhythm, is it regular or irregular? Quality, is it strong, weak? That's what you're looking for. These aren't vitals. This is enough to keep the patient alive or not. Next, you're looking for skin signs, color, moisture, temperature. Of course, use the back of your hand, touch part of the skin, abdomen, somewhere where you're going to get a good temperature reading for color, moisture, temperature. Capillary refill. You do a cap refill check, and if it's under 2 seconds, it's considered immediate. Over 2 seconds, it's delayed. Sometimes in the elderly patients, you may see a delayed response, which is normal because of poor circulation. Then you want to cut and expose all areas for any uncontrolled hemorrhaging. This is under circulation. Number 7, determines patient transport priority. This is where you refer back to the first page. Remember the load and go criteria, alter level of consciousness, uncontrolled hemorrhaging, compromised ABCs. Those 3 are what's going to determine your first load and go criteria. You actually have to make a decision at this point. It's not enough to say load and go criteria or first transport decision. You have to say this is a load and go or we're going to stay and assess. Number 8, delegates vitals, sample, backboard prep. This is easy 2 points to capture, so make sure you memorize it. Now we're going to go to the rapid trauma assessment or secondary assessment. We went through the initial assessment, primary survey. Now we're going to go through the rapid trauma assessment, starting with the head. First thing we want to do with every section is expose and observe before we palpate. We're going to start with the head. First thing you want to do in each section is expose, observe, then palpate. So we're going to expose and observe for decap BLS, deformities, contusions, abrasions, punctures or penetrations, burns, lacerations, or swelling. You actually want to expose it. Then we want to palpate the head. Check for your hands for blood. Check the anterior of the neck. 5 things on the anterior side. Of course, expose and observe for decap BLS, jugular vein distension, a stoma, medical alert tag, subcutaneous emphysema, deviated trachea. On the posterior of the neck, this you want to palpate the posterior for any step off, misalignments, and point tenderness. Check your hand for blood again. Next, we're going to go to number 11, which is the chest area. Again, we're going to expose and observe for decap BLS. At this point, we're going to also observe for 4 things: flail segment, paradoxical motion, sucking chest wound, or any penetrating objects. Then I'm going to palpate for tick, tenderness, instability, and crepitus. The sternum, I'm going to push down, anterior to posterior. Check the rib for stability, lateral to medial. That's the motion I'm going to make. I'm going to move over to the abdomen, which is number 12. Expose and observe the abdomen for decap BLS. I'm also going to observe for Dr. Germ. You're also going to palpate for Dr. Germ as well. Dr. Germ stands for distension, rigidity, guarding, evisceration, rebound tenderness, and any pulsating masses or hot belly. Draw across right at the navel as a good guide, and you got your 4 quadrants. You're going to palpate all 4 quadrants. Now, the pelvis. You're going to expose and observe the pelvis for decap BLS. You're also going to palpate for tick using anterior to posterior, lateral to medial motion on the bony part of the hip for any stability issues there. You're also going to check for VIP, vaginal bleeding or discharge, incontinence, or priapism. Upper thighs. Expose and observe for decap BLS. I'm going to palpate this time for tick using offset pressure. You're going to use that offset pressure motion on the thighs. And then you're at your second transport decision. Now flip back to the very first page, load and go criteria, and it's the next 4 bullet points: abnormal chest, tender abdomen, unstable pelvis, bilateral femur fracture. If anything is wrong with this area here, it's a load and go. You have to verbalize that. This is a load and go because, or there's nothing found, we're going to stay and assess. You have to make that decision. Off to number 16, lower extremities. As with the other parts, we're going to expose and observe for decap BLS. You want to verbalize it even if it's exposed already. Expose and observe for decap BLS. Then I'm going to palpate for tick using offset pressure bilaterally. At this point, I'm going to check for PMSCs, which is pulse, motor, sensory, cap refill. Pulse, I'm going to check the pedal pulse. Motor, if he's alert and oriented, I'm going to have him wiggle his toes. Which toe am I touching? And also check cap refill. Upper extremities, I'm going to do the same thing. Expose and observe for decap BLS. Palpate for tick using offset pressure. Bilaterally, both sides. The humerus, radius ulna. Again, I'm going to check pulse, motor, sensory cap refill, which is your PMSCs. Pulse is going to be radial pulse. Motor, go ahead and wiggle your fingers. Sensory, which finger am I touching? And cap refill,